Do you have diabetes? If so, your mouth could be affected as well. Yes, oral health and hygiene are important for everyone, but even more so for those diagnosed with diabetes, as the condition itself can make it challenging to maintain good oral health. But why? Let's take a look. Diabetes is a chronic health condition that affects how your body turns food into energy. The food we eat is generally turned into sugar, also known as glucose, and is released into our bloodstream. When the level of sugar in our blood goes up, our pancreas is signaled to release insulin. Insulin acts like a key to let the blood sugar into the cells in our body to be used as energy. With diabetes, the body doesn't make enough insulin or can't use it as well as it should. When there isn't enough insulin, or cells stop responding to insulin, too much blood sugar stays in the bloodstream. This is where the damage to the mouth can begin. High blood sugar can weaken white blood cells. White blood cells defend and fight off infections in our body, including infections that can occur in our mouths. If white blood cells are compromised, the risk of developing an oral infection increases significantly. A higher level of sugar in the blood means there is also a higher level of sugar in saliva. Take a moment to think about our mouths and how they're designed. Saliva covers almost every surface of our teeth, tongue, and cheeks all day, every day. So if that saliva is full of sugar, it creates the perfect place for bacteria and germs to congregate, multiply, and cause infections. There are other ways that diabetes can take a toll on your oral health, such as decreased saliva production that can cause your mouth to feel dry. So not only is your saliva full of sugar, but an inadequate amount is produced, which can increase your risk of infection. It is important to note that dry mouth can also be caused by certain medications, which is why communicating with your primary care provider is the best way to determine what is causing dry mouth. Your gums may become inflamed and bleed often, which is a sign of gum disease. Gum disease can be more severe and take longer to heal if you have diabetes. It can also be harder to manage your diabetes if you have gum disease. Other symptoms of gum disease include dry mouth, loose teeth, and mouth pain. If you notice any of these symptoms, reach out to your dentist as soon as possible. Infections in your mouth can take longer to heal. This includes conditions like gum disease, tooth infections, fungal infections like thrush, and more. Wondering what you can do about your oral health if you have diabetes? The best thing you can do for optimal oral and physical health is to keep up with your regular visits to your dentist for professional cleanings, x-rays, and checkups, and to follow your diabetes care plan designed by you and your care team. Other tips that can help maintain good oral hygiene are brushing at least twice a day with fluoride toothpaste, flossing at least once a day, and making sure that your dental care team is aware of your diabetes diagnosis, as this can drastically affect certain aspects of your dental care plan. It's not easy to live with diabetes, but with the right education, support, and guidance, you can improve your health in all areas, including oral health. By scheduling regular checkups with your primary care provider and dentist, as well as educating yourself about the importance of oral health, you can help ensure that you'll be able to keep your teeth for years to come. If you have any questions about how to improve your oral hygiene or overall health, don't hesitate to reach out to your primary care provider for help.